Hi, I'm David Klein. I'm an orthopedic surgeon at Kennedy White Orthopaedics in Sarasota, Florida. In this orthopedic moment, I'd like to talk to you about post-operative care after your shoulder surgery. Most likely, when you went home, you had your arm in a sling, and you may not have much pain at your shoulder because most of the surgeries are done with some local and some regional anesthesia. That will wear off in a matter of hours, sometimes into the next day, or even a day or two later. When that happens, it's important that you have your prescription filled for pain medication, and I would recommend that you take one not when you're not having any pain, but wait until you either get back light touch sensation, but don't wait for pain, or wait until you go to sleep that night after the surgery and take some medicine before you go to sleep. That way, when the numbing medicine wears off, if it does in the middle of the night, you'll have some pain medication on board. With respect to the sling is there both to support your arm so you're not using the muscles of your shoulder, and also to keep you comfortable. You may have to adjust it to put it in a more comfortable position if you feel that things are too tight or in the wrong place. Sometimes it will shift when you sleep or when you ride in a car or sit down, and it may take some adjustment. If you've had rotator cuff surgery, you probably have a pillow or a cushion that is between your forearm and the body. This is there to take some of the strain off of the rotator cuff, and your arm should be positioned so that it rests upon the pillow and the pillow rests upon your abdomen. With respect to your hand, we do want you to move your fingers so that you don't get stiff. Expect that you will get some swelling that will go down the arm, possibly with some bruising into the arm or the chest wall, which can be significant at times. Also, unless you are instructed not to, you should come out of the sling once or twice a day just to straighten your elbow out and let your arm hang down. That's also a great way for you to wash under your armpit, put on a shirt, put on deodorant, and so forth. It's much easier to get under your arm if you bend at the waist and let the operative arm hang towards the ground, using your other arm to wash under your operative armpit, help with other daily hygiene, deodorant, and so forth, and to get dressed. Also, you can even wash your non-operative arm just by bending your elbow on the operative arm, and your hand will go towards the opposite armpit. That's much easier and much better than trying to pull your arm away from your chest while you're sitting or standing. Furthermore, we want to make sure that you follow any instructions that you've been given about wound care, use of the hand, what you're allowed to lift or not lift. For the most part, you can lift lightweight items with your hand, such as a cell phone, such as a cup of coffee, but we really don't want you doing much more than that. With respect to the dressings, most of the time I instruct my patients to keep their dressing in place for about 5 days and then remove it. At that point, they can wash with soap and water and put clean, dry dressings back in place. If you have any questions, please call the office. Otherwise, we're looking forward to seeing you at your scheduled post-operative appointment.